Hi everybody, this is Jeremy Galloway. I'm the Overdose Prevention Coordinator with Families for Sensible Drug Policy and the Education and Outreach Coordinator with Georgia Overdose Prevention. Here to talk to you today, try and make it as quick as I can about overdose prevention, the scope of the overdose problem in the U.S. and Georgia, and Naloxone, what Naloxone is, and a little bit about harm reduction. So I'll give you some statistics to start with. In 2015, according to the CDC, there were over 47,000 overdoses. That makes it the leading cause of accidental death in the country, and it's been that way for quite a few years. About 5, 6, 7 years ago, it overtook automobile accidents as the leading cause of accidental death. Since 2001, there's been a 500% increase in just heroin deaths alone. That doesn't include prescription opiates. There's been about a 300-400% increase in deaths from those since 2001. And prescription opiates would be like Oxycontin, Vicodin, Percocet, morphine, fentanyl, those sort of things. They're the leading cause of overdose deaths, but we've seen in the last 3 or 4 years a really huge spike in heroin-related deaths. In Georgia in 2014, the latest year we have figures for, there were 1,206 overdose deaths that we know of. So that equals that's over 3 people per day, about 3.5 people a day, which when you think about it is pretty significant, especially when you take into account the fact that that touches a lot of friends, family, and loved ones who personal connection with somebody that died from an overdose. So the way that I got involved with this work is about 3.5 years ago. I lost a really close friend to an overdose. His name was Nick. He had just gotten out of jail and was on his way to rehab. Somebody picked him up from the rehab, or from the jail. I'm sorry, and he never made it to the rehab. He was found 2 days later in his mom's yard by a landscaper. His mom wasn't living at the house at the time, and the person that he was with didn't call 911, didn't take him to the hospital because he was scared that he would get in trouble. So out of that, me, my wife, Atlanta Harm Reduction Coalition, and a couple moms who had lost children to overdose got together and organized the first Georgia observance of International Overdose Awareness Day in 2012. And actually last year, 2015, we had the vigil and observance in Dahlonega. And we had a pretty good turnout to that, and a really good response. So the law that we got passed, and kind of how Georgia overdose prevention was born, was out of that first observance of International Overdose Awareness Day. And our goal was twofold. The first was to get a medical amnesty law passed so that people wouldn't be scared to call 911 if they were at the scene of an overdose. And the second was to grant access to anybody in the state to have naloxone. And naloxone is a medication that reverses overdoses from opiates, and like the ones I told you about earlier, and heroin. So what it does is the opiate, which usually breaks down to morphine, will sit on the opioid receptors in your brain, which causes euphoria and pain relief. But one of the side effects is that it also slows your breathing down. So if somebody takes too much, it'll slow their breathing down enough to where they're not getting enough oxygen, and eventually they'll die. Naloxone can work. Overdose death isn't instant, and about 98 to 99% of the time when naloxone is administered in time, it reverses it'll reverse the overdose. So that might be anywhere from 15 to 20 minutes. It would be up to an hour or two. It really just depends on how potent the drug that the person took was. What naloxone does is it goes and it has a stronger affinity for those receptors, so it rips off the morphine or whatever other drug is on there and sits on those receptors and doesn't activate them, so it immediately starts that breathing process back, and within a minute or two it'll bring the person out of an overdose. So I'll talk quickly about how to administer naloxone and the different forms that it comes in. One of the forms that we distribute at Georgia Overdose Prevention and Atlanta Harm Reduction Coalition is this intramuscular version. Let me try and get it to where you can see what it looks like. There's a little bit of liquid in there. That's naloxone. It's, like I said, it's intramuscular, and what that means is that I won't show the needle so that I don't trigger anybody that might be sensitive, but you basically turn this upside down, pull the liquid out, and inject it in the deltoid muscle or the thigh. One of the ways to recognize an overdose is if somebody is unconscious, if they're unresponsive, if their breathing is slowed down. If you yell their name, they don't respond. We do what's called a sternum rub, and that's where you put your knuckles in here, right in this breastbone, and rub, dig them in there as hard as you can. If somebody doesn't respond to that, it's really painful. If they don't respond, then they're probably overdosing. Step 1 is to call 911. If they're not breathing, step 2 is to administer rescue breathing. If they don't have a pulse, you're going to have to give them CPR before you can even administer the naloxone. Although they usually will have a pulse, but if their blood's not pumping, the naloxone's not going to get to their brain. So call 911. Administer naloxone, and if you don't have a response within a minute or two, every kit that we distribute has 2 doses, and usually that second dose will take them out of it if the first dose doesn't. Another version of naloxone that we distribute is called an FZO AutoInjector. It comes in a box like this. The company that makes this they're called Kaleo, and they've been really generous to us. They get grants and let us apply for grants, and they just donated 500 free kits to Georgia Overdose Prevention, which we wouldn't have been able to provide otherwise because we survive completely on donations. We're not a 501c3. We don't get any grants. Every penny that we collect, it goes toward buying more naloxone, and we can put together one of these intramuscular kits for about $35-40, which is why that's usually what we distribute, is because it's the most affordable version. These FZO devices cost retail, they cost quite a bit, but fortunately the company has programs where if people have commercial insurance, or if they don't have insurance, there's a couple different processes they can go through to get a free kit, and I'll talk about that in the bottom below, explain those processes, and include some links. So each FZO kits comes with a training device. This doesn't contain naloxone or a needle. The live device does contain naloxone, and you can see it right there, and it does have a needle that comes out automatically, retracts automatically. There's very low risk for contamination with HIV, Hep C, or other bloodborne pathogens, so it's super safe. A lot of police departments are carrying this. I'll give a quick little demo of how this works. It talks you through the whole process. It's foolproof, which in an overdose situation is really important.
This trainer contains no needle or drug.
So it's going to tell me to pull this red part off.
Black end against outer thigh, then press firmly and hold in place for 5 seconds.
It's really difficult to mess this up. The first time I did it, I messed it up, and it's going to remind me. So you push it in. It counts down.
2, 1. Injection complete.
Once you hear that beep, it pulls the needle back in, and that's it.
Reused for training purposes.
So yeah, that's the FZO. The newest version is called Narcan, and some of y'all might know that name. That's the brand name for naloxone, and this is a nasal spray. It's a one-piece device, and I lost the cap somewhere along the way, but you pull this cap off, stick it up the nostril, push this little piece on the bottom, and that's it. Super easy. A lot of police departments are being equipped with this, and school nurses and things like that, because there's no risk for disease transmission with this. These retail for about $37 a piece, and each kit comes with 2 of these devices. So that's it about naloxone. Some statistics about overdose reversals in Georgia. Since the law went into effect in April 2014, from kits that naloxone rescue kits that Georgia Overdose and Prevention and Atlanta Harm Reduction have distributed, we've had 383 reversals from those kits that we know about. Those are people that called the number that's in the kit and told us that they reversed an overdose or requested another kit because they had used one. There are 33 or 34 law enforcement departments in Georgia who are now carrying naloxone, and there have been 47 law enforcement reversals. So that's 429 total that we know about. There's probably more, and that figure is about 2 weeks old. So since then, we've probably had even more reversals that we're constantly adding to the list. Last week there was a reversal by a Forsyth County Sheriff deputy, so this is something that's hitting really close to us. I know someone who her son died from a heroin overdose in Blairsville last year, so it's not just prescription painkillers up here that are killing us, it's heroin's up here too, and it's killing a lot of people. North Georgia has the highest overdose rates in the state and some of the highest overdose rates in the country. So I'm going to read you the laws real quick and wrap it up. I'll include some information about harm reduction and some links to some things that might interest y'all. One thing that I would be interested in for anybody that wants to do kind of a bonus activity is I'd really like to hear some of y'all's ideas on what we can do to address the opiate and heroin problem in Georgia and even the rest of the country, and more effective ways that we can provide people overdose prevention resources and, most importantly, treatment options, because we don't have a lot of treatment options here in Dahlonega or North Georgia because it's really rural. There's not a lot of treatment resources in Metro Atlanta, even so, and we've got even fewer here. So that's one of the reasons that we have such a high overdose rate. So Georgia's 911 medical amnesty law. Just a brief summary of this, and I'll read it so I don't mess it up. If you're at the scene of an overdose and call 911 for help, you cannot be arrested, tried, or convicted if police show up and find small amounts of drugs at the scene. That includes 4 ounces of anything like, not 4 ounces, 4 grams of anything like heroin, cocaine, methamphetamine, which is we've got a pretty progressive law. That's a pretty high amount. The law is meant to protect people who are using drugs, not people who are selling or trafficking large amounts of drugs. And it includes like amounts of marijuana, which people don't overdose from marijuana, but it might be at the scene of an overdose. The law protects both the caller, the victim, and anybody who stays with the victim, and grants immunity from parole, probation violations, or arrest for most type of warrants. Importantly, especially for colleges, is that it covers underage drinking. If somebody calls to report alcohol poisoning and there's underage drinking involved, it provides the same immunity for people who call or stay with the victim there. The Naloxone access law is basically, Georgia law now allows anyone to carry naloxone, the medication that can reverse overdoses from opiates like heroin, methadone, OxyContin, Vicodin, and etc. It also allows the person administering naloxone protection from civil liability if anything goes wrong, but it's nothing going to go wrong. It's pretty safe medication. There's no abuse potential. And if you know anybody at risk, or if you're at risk yourself, and you want a naloxone kit, I'll leave information to get in touch with Georgia Overdose Prevention or Atlanta Harm Reduction to get a free kit. So thanks for your time. I really appreciate y'all listening to this, and I'm really interested in hearing what y'all have to say. Take care and have a great day.